afternoon, everyone, and thanks for joining again another edition of Superior Health Quality Alliance Roundtable Conversation. My name is Kim Heft, and I am joined by my colleagues Elena Baer, Mary Funseth, Jill Hansen, and Jerry Hineker. For those of you that have been joining these meetings, welcome back again. You guys are steady eddies, and we love you for being here. We host, just to give you another little overview, in case you're new out there, we host this session each week. It consists of a 30-minute educational session where we highlight important topics related to COVID-19 vaccinations, boosters, other nursing home topics, hotspots. And at the end of towards, I should say, the end of this session, there'll be a survey that we would please ask you to take a few minutes to complete. And momentarily, Jerry's going to put the link for this PowerPoint presentation into chat. Please use the chat box to share any comments, questions, or anything else that pops into your mind during the presentation. And we'll use that for a discussion in the Q&A portion of this event. Now, today's event is taking a slightly different twist. Superior Health, we offer our participants an array of support by providing resources, technical assistance, webinars, and other things. And so today we're going to share a few of these supporting tools in hopes that you, our audience, will use them in your everyday work now and in the future. So let's get started. But first off, I know this might sound silly, but let's just make sure that everyone, just in a high overview, understands what is Superior Health Quality Alliance. It's our mission is to improve the quality of health and healthcare for our healthcare consumers, our clinicians, our healthcare organizations, and our communities. Now, there's three networks under the Superior Health umbrella. We have an end-stage renal disease network, hospital association network, and then where all of you fall into is the Quality Innovation Network, or you may hear of it called the QIN. Now, there's 12 QINs in the US, and our QIN is represented by 3 QIOs, so 3 quality improvement organizations. So the 3 QIOs are Improve Health, formerly known as MPRO, and that's out of Michigan, Metastar in Wisconsin, and Stratus Health in Minnesota. And what we do as this QIN is we help CMS improve the health and healthcare of the residents in your homes. Now, that's a very high level overview about who we are, but at least I just wanted to give you an insight about what it is that we do and what we do for you. Okay, so our objectives for today is we're going to give an overview of Superior Health's educational opportunities. We're going to describe frontline forces training modules and how to implement those for your frontline staff. We're also going to give you an overview of Superior Health Connect, how to enroll and participate. And lastly, we're going to demonstrate how to confer NHSN rights to Superior Health and what benefits that is to you for conferring rights to us. So with that said, Elena Baer, she is up first, and she is going to tell us about Superior Health's educational opportunities.
Thanks, Kim. Yeah, so you can go on to the next slide for me, please. So we have a lot of different opportunities to participate in our work. You're already clearly participating, so thank you so much. Like Kim said, there are so many familiar faces and names on these calls, which I'll explain a little bit more what this type of offering that you're already participating in is called. So what our overall goal is with all the different opportunities we have for participants to participate is to meet them where they're at. So whether that means that you're just looking for something to pop into every once in a while when a topic serves you and when you have the time to do so, or if you're really looking for some very specific, more labor-intensive technical assistance. We have a lot of different opportunities for all sorts of different things. Like I mentioned, there are different levels of participation, which I'll get into a little bit later. And all of the opportunities that we do present are voluntary, but they're always available for free. So anything that you ever see come out of Superior Health, know that it's free and available for you to join. Now, how do you find out about those events? They can be found in emails. We send out pretty regular e-blasts, which hopefully all of you are getting. They could be found on our website, which is linked right there. That'll take you directly to the events page, or it can be found within our platform, Superior Health Connect, which I know my colleague Mary is going to go into a little bit later on. And one quick tip, if you aren't seeing some of our emails, we suggest you add info@superiorhealthqa.org to your email contacts to help improve deliverability of our email messages. So if you don't think you're getting those, I know we send typically a nursing home e-blast out at least once a month. And we also send an immunization focused e-blast out once a month as well. So if you're not seeing some of those come through, try adding that info@superiorhealth.qa.org to your email contact list. And then the last thing I just want to mention on this page is that almost all of our opportunities are recorded. There are a few of them that aren't. And all of those that are recorded can be viewed later on our YouTube page. So if you click on that link right there, you'll see a lot of the former calls that we've had right here up on that YouTube page and several other opportunities that we have available as well. Next slide, please, Kim. So as I mentioned, there are different levels of participation. We have the independent implementation, affinity groups, and structured collaboratives, which I'll get into with just a little bit more detail in the next couple of slides. But we have opportunities in all three of those categories within our 5 strategic goals, which are increased quality of care transitions, increased patient safety, increased chronic disease prevention and self-care, improve nursing home quality, and improve behavioral health outcomes, including opioid misuse. So when you go to our events page, when you get some of those e-blasts, you'll likely see opportunities within some of those different areas. So even if you've mainly been participating in like this call, there are other opportunities as well if you're focused on some other areas within these goal topics listed down below. There are other opportunities out there that you could join as well. Next topic, or next slide, please, Kim. So the first level of participation is the highest level of technical assistance. One thing I do want to mention that you don't really see on that visual that I just showed on the last slide is the one-on-one technical assistance. Some of you might be really familiar with that. It's when a team member from Superior Health reaches out to you, could be about immunizations and COVID-19 boosters. It could be about infection prevention and control. Maybe you had a COVID outbreak and our team called you and helped you. That's not something you'll see on that visual or within these 3 different implementation strategies, but it's definitely something that our team does. And if there's something very specific that you need assistance with, don't hesitate to reach out to someone. If we don't have the answer right away, we'll look it up, we'll reach out to one of our colleagues, and someone likely does have the answer. So keep that in mind as we walk through this presentation, that if you need help, that's what we're here for. But in terms of the opportunities that you'll see listed on our website or in those e-blasts, we'll have things like structured collaboratives. Like I mentioned, that's the highest level of group technical assistance, and it's designed for large scale improvement. So this includes cohorts of structured learning through a tele-echo or virtual training that allows for sharing and networking. If you're not familiar with what a tele-echo is, it is basically a virtual meeting similar to this. They have smaller groups of people, so it could be 25 to 30 people so that we can all kind of see each other. And it involves a short didactic presentation, usually around 15 minutes, and then opportunities for sharing and learning, and then a case presentation. So typically one of the participants would come on and share a case presentation, typically connected with the content that was presented in that didactic presentation. And you would learn from others, get ideas, share best practices, etc., within that case presentation. For an example of virtual training, we've done self-measured blood pressure training for clinics and other things like that. So we have a lot of different opportunities under these structured collaboratives. Now, these structured collaboratives will likely require several sessions, at least 3 or more typically, and they could be weekly, they could be every other week, they could be monthly, and the goal really is to view progress over time. With that, next slide, please, Kim. The next level is the affinity group, and that's actually what you're all sitting in right now. So welcome to your affinity group. And this allows us to build virtual community by connecting individuals, healthcare organizations, and community-based organizations across our region. So participants work together to achieve common goals and improve health. So within this affinity group, our focus is on COVID-19, boosters, immunizations, and everything that kind of surrounds that. So you're all kind of working together, you're asking questions in the chat, you're sharing what's working for you. And that's really what an affinity group is all about. So thank you all for really participating. It's an all teach, all learn environment where best practices are identified and spread, and activities within the group are determined based on input from the participants. So that's why you hear often the facilitators of this call asking you, please let us know what is that pebble in your shoe. That's why we really want to know, is because we want to cater these calls, the topics that are presented, to what your needs really, really are. And this right here is our moderate level of technical assistance. So it's right in the middle there. There's not going to be these large scale improvements necessarily, but you're probably going to come here and you're going to learn a little bit each time you come. You're going to share with each other and maybe make some contacts outside of this call as well. Next slide, please. And then our final implementation strategy is the independent implementation. And this is designed for greater autonomy and quality improvement. So it's our lowest level of technical assistance. It's great for self-guided learners. So maybe you don't need that support of someone on our team, but you want to use some of our resources. And again, that's what we're here for. If we don't already have it and it's something you're looking for, we can likely create it. And it allows you the ability to use those resources at your own pace. So examples of independent implementation resources could be checklists, educational resources like one-pagers, tip sheets, etc., one-time webinars, and self-guided learning modules. So those are our 3 strategies that we use to kind of put out different education to everyone. So we hope you'll kind of look out for those. And with that, I'm actually going to turn it over to Kim again, who's going to talk about one of our independent implementation strategies. So Kim, take it away.
Yeah, I'm actually glad you just said that, because I was like, hey, that's an implementation strategy for sure. Yeah, and what we're talking about here is frontline forces. This is on-demand, digestible, engaging educational training modules for your frontline staff. So with the audience that I have here today, it's your CNAs, but it could be health, home health aides, medical assistants, even family caregivers could utilize these modules. What we did is we wanted to focus our efforts on those who spend the most time with the residents, right, or the patients. And then because they have the greatest impact on outcomes for the residents and patients across all these multiple care settings. So we figured targeting them would definitely enhance these outcomes, positive outcomes. Now, these short on-demand learning modules, they are there to fit into the routine of the day without causing lengthy interruptions. Most are about 15 to 20 minutes long. Now, we know that confidence is a key part of doing a job well. So they are meant to empower and engage your direct care staff by building confidence and skills they need to support quality care. These modules also build on current knowledge, and all of our modules are supported by evidence-based practices. We currently have 7 topics in our library. So for example, pressure injury and prevention. This has 3 sections. We have, it's one of the sections is just on like the prevention part. And then we have the different stages of pressure injuries. And then lastly, what is that role of that frontline staff under this, for this module, under pressure injury. Hand hygiene, that's one module. It's about 20 minutes long, has been a popular module because of our recent pandemic, along with vaccination. It covers safety of vaccinations, and then it also has an influenza and a hepatitis B parts 2 in this module. And being that influenza season's coming up, maybe this might be a good module for some of your frontline staff to view. We also have our most recent change in condition. This is a 4-part series, with the last one being a case study. But we also have a substance use disorder module. It has what is in it. I mean, not what is in it. What is substance use disorder, combating stigma, finding help and prevention. But we also wanted to make sure that we're taking care of our frontline staff. So we have a caregiver and well-being module. And this series has small exercises where your frontline staff can learn how to meditate, how to breathe. There's stretching exercises, among other things in that one too. And then one of our first modules that we had done was preventing falls and fall injury. Again, we go through the risk factors, the significance of falls, and understanding the role for that frontline person when it comes to resident falls. So how does this all work? So basically, the staff, they watch that short video, and then as they're watching it, they can pause it, they can come back later, they can use the timeline slider to move it back and forth. So it's not like they could it's just very user-friendly so that you don't lose your place. You can go back later. Now, most of the modules, they do include a test your knowledge quiz. So after watching the training video, you can click on the link, it's test your knowledge, under the video, and then take that short quiz. And that quiz taker, though, here's just a tip. The quiz taker, they need to provide some basic information, including an email address. So you, as the supervisor, staff development coordinator, whoever is assigning these modules, what I would have the participants do is put in your email, that administrative staff or supervisor email, instead of their own, because once that person does the educational module, takes the quiz, that test score and the quiz taken is going to go right back to your email. Now, they can still see their test results, because after they're done with the quiz, the staff will be able to see their quiz score and a list of the questions that they didn't get correct. Now, we do consider a score of 80% or better, indicating that they understand the content. And if it's not achieved, what we do recommend is that staff go back and watch the training video again, or actually to come to you to seek additional training from the supervisor. I just wanted to note, though, that we do not offer, though, any continuing education credits for these frontline forces modules. And this is just an example slide. This one happens to be influenza. As you can see, they would just click on the YouTube video to watch the presentation. Then below it is the take the quiz link. And then what I really do like is every single module we have has resources available. So then you can see where we obtained all of our information for these modules from. So you can gain additional information. And then I have to promote our upcoming modules. We have a 3-part series on UTI. We are going to have a series on how to take a blood pressure. There is definitely a correct technique for this. We're going to have a smoking cessation program for the frontline staff. And then also a behavioral interventions for people with dementia. So again, instead of putting on another psychotropic med or upping that medication, showing different ways to put behavioral interventions in place instead of medication. So that's frontline forces. So I hope that these modules will be useful for some of you in the future. Okay, so up next is Mary Funseth, and she is going to talk about Superior Health Connect.
Thank you, Kim. I am going to go through the couple of slides that I have, and then I'll ask you to allow me to share to do a fast demo.
Sounds good.
So you can start us on that next slide, please.
Okay.
So as you see here, Connect is a shared learning environment for all of you, as well as for all of us who work at Superior Health. It's a great way that we've been able to foster that, promote all teach, all learn. You being the experts in the field, we being here to help you to enhance your initiatives and be on hand to share some best practices that we are hearing from around our region. In this particular slide, you'll see at the bottom, we won't click it now, but that does take us to Superior Health Connect, but it also is a way for you to join us. And I am going to ask that, Jerry, are you able to put that link in the chat? And if not, I will be able to put that in before the end of our session today. So Connect is just one of those tools that Superior Health is using to support and improve health, in healthcare for all the Medicare beneficiaries and everyone that you're serving. We're hoping that it's going to allow to remove the gaps that prevent individuals and organizations from reaching their health potential. And we're also hoping that this is the opportunity to learn about and share those proven processes and guidelines that help all the participants build bridges and promote equitable health results across all of health settings. We are currently within Superior Health Connect 485 members. And this has been exciting as we grow, more and more folks join us. And we have seen a lot of great opportunities for participants to engage with each other, engage with us as quality advisors at Superior Health. And it has been an opportunity for participants to ask questions, whether you do that through a post or something in a group, or perhaps simply we do have a chat function. So it's a great way to connect with us, the advisors, at any really given time. It makes it very efficient, and your requests, can be answered very quickly, and we don't have to set up a meeting. So basically, it's a great place for you to all go at your leisure, find those resources that will fit your resource or your needs at any given time. Now, this is not, you can go to the next slide, Kim.
Okay.
This is not Facebook. This is not LinkedIn, but it kind of is easy to sort of compare that way slightly, because there is that opportunity to enjoy posts from others and a discussion. It's also you'll also see how we can keep everything sort of organized in order to find the resources that we have to offer to you. So if you'll hold 1 second, and Kim, if I could share now, that would be great. Okay, hold 1 second. All right, so now I'm taking you right into Superior Health Connect. Kim, are you seeing it?
We are good.
Good, great. Okay, so what you're seeing is where you arrive on the page when you go out on a regular basis to take a look. All of you will see a welcome section when you arrive and join us. And in here, you will see what I have shared with you. And it will also guide you through what to do to set yourself up to enjoy Superior Health Connect, so that it is something that works well with your practices on a daily basis. It's not intended to get in your way because it is here when you need it. We are hoping that you will consider possibly adding your photo. A number of us have. You'll see as I navigate around the folks, you're going to be able to also see a little bit about information on how to navigate using posts, articles, polls, and so on. So you will get some directions. And it also talks about, which I will show you directly, how to use things like topics, join a group, and take a course, and so on. Now, what you're going to see on my screen might be ever so slightly different than yours when you do arrive here. I am a host within Superior Health Connect, so sometimes I can see a little bit more than everybody else. But generally, this is what you're going to see when you get there. This is your front page. And as you can see, there's a variety of things here on the general network page. And each of these are excellent resources or announcements. You are going to be able to find folks or find things through discovery. So if you're really interested in looking for something, say about diabetes, simply put it up in that search bar and it would bring up some different articles that were placed there about diabetes. You also can find members. So in this particular case, if you're looking for someone, again, that search bar is here for you. You'll be able to do things like, if you were looking for Mary Funset, you'd be able to type in Mary. You might not remember my last name, but it would bring up all the Marys, and possibly, seeing all those last names would trigger you to know which one you're looking for. You'll also be able to find out who is near to you. So people who are near in your state or area, that is very helpful. Also, if you're maybe looking for your staff, did my staff join? You can certainly look up those folks as well. In this particular case, online now, some folks just hold it open all day. I know I do, but what that means though is as something happens, I will hear a little ding, and I'll hear as things advance. Again, we have an about page where you can go, and in this particular case, I do not think that you will see the invite button. But again, it will be that description. So if you had to share this with your colleagues and wanted to tell them more about it, you'll be able to go to that about section and share that easily. Let's go into topics. All of these topics are fairly high level. So as you join a topic, you'll be able to watch for things that may interest you. And as you join a group, depending on how you set your notifications, you'll either be alerted something new has come forward to take a look at, to comment on, to share your best practice, or maybe even make requests. But in each of the topics, you will see, in my case, I'm following this one. You'll see I actually created chronic disease management, so I'm not quite sure why it says to follow because I'm already there. But you will see things like the button follow, where then you will click on it and you will be let right in and you'll be one of the people following this. As you can see, it's care coordination, chronic disease management, infection prevention, medication safety, person-family engagement, and then it also just has a section of events and health equity. Affiliations is an opportunity for you to join up. When you're joining, you'll be able to select an affiliation if you'd like. You're able to join more than one affiliation, but it does group you with others, so you can easily find others who may have like interest to you. As Kim and definitely Elena mentioned, we do have groups. This is where you're going to find your structured collaboratives and your affinity groups. And this is one opportunity for you to possibly join here, but most often your invites will come through either a mass email, or if you find us on the different e-newses that Superior Health come out or brings out. But you can also see it here. If there's ever a time when you feel like you want to join something and you can't get into it, you would just ask one of us to help you do that. In this particular case, as I mentioned, I'm a host, so you will see that this particular one on nursing home sepsis affinity group is secret. The reason that is you would be joining that separately through an invite process, and then the group is using this as a place to share and store their resources that they're enjoying during their affinity group. So it's not that others aren't invited, it's just that their discussion here may not make sense unless you're in those sessions that the affinity group is hosting. Also here you can find the courses that were mentioned by Kim. And then last, we also have an easy way for you to look up events, and all the upcoming events will be here, along with the opportunity. As you can see, you can just simply register to attend, which is a very quick one-stop shop for you to enjoy getting into some of the events that we have. I will pass this back to Kim, and then when we get to our question session, please feel free to ask questions, and we can see what we can do to answer those.
All righty. Okay, let me get back to sorry, guys. All righty. Are we back?
Yes.
Excellent. Thank you. All right. Thank you, Mary. So what do we have left here? We have Jill. Jill is going to talk about conferring NHSN rights to Superior Health. So you're up, Jill.
All right, thanks, Kim. If you want to advance the slide. All right, so as Elena and Kim and Mary all mentioned prior, we're very excited that all of you are here. Some of you may have already conferred rights to us to the National Healthcare Safety Network, or NHSN, but for those of you who haven't, just going to give you a little bit of background of how you can do that and really what it means when you confer rights to us. So essentially, when you confer rights to Superior Health, it means that we have access to your infection prevention data that's within that NHSN website. And so the reason why we ask for that information is, as Elena had mentioned, you may or may not have already received personal calls from us specific to, say, COVID vaccinations. And so one of the things we look at is we actually go into the NHSN to see if we can actually see your data and just take a peek prior to those phone calls. So if we're not able to access your data, we're sort of looking at it blind and relying on a little bit of dated data from a data file from CMS. So it's actually a way for us also to identify sort of best practices that are happening within your organization. And you might go, I'm not sure that we have best practices, but your data tells us otherwise. So, and really from your standpoint, it really is a minimal lift from your end. I think the biggest thing is just to know who your NHSN administrator is and within your facility. And then once you actually confer rights to us, just know that sort of you have this ongoing support from us. Next slide, please. So again, our most recent piece that we have been utilizing NHSN right now for is really looking at sort of we're completing some NHSN data validation around COVID-19 vaccination data, and most recently the booster data. We're also looking overall at your NHSN reporting data, and we can actually, one of the things that we've realized is while CDC does a nice job of having some check steps within their system, there are a few little check steps that we've realized that we can add value for your organization. So I'll give you the example. If you enter in your weekly booster vaccination data, and last week you entered in 90 of your residents had received a booster vaccination, and this week you actually enter in 10 vaccinations that they've received the booster because you're counting the weekly total as opposed to your overall total. NHSN does not flag that. So you can go along and enter that information in, but on the back side at Superior Health, we actually are looking for those pieces, and that's really where we do our reach outs to you. Having access to your data allows us to actually go in and pinpoint the specific survey week that we've begun to see that data hiccup, and that allows us to really give you the information. So you're not going, so versus us saying, we think you have an issue with your data, to actually saying for the survey week ending July 12th, here's where we're seeing the information. It also allows us then to do sort of a post review and a validation periodically, and then as well circle back as needed. So next slide, please. So in this slide, I'm not going to have Kim click on this link because I've included screenshots, but if you're sort of post this webinar, you can actually go in via this link to actually find the information, and it's sort of a little PDF document that'll kind of walk you through how to confer NHSN rights to us. So I think the only thing that you should know is really only your NHSN administrator within your facility is able to confer those NHSN rights. I will also give the caveat, it's also, we recommend to have at least 2 individuals within your organization actually have NHSN access. So if that's 2 in addition to your NHSN administrator, that's even better, because if your NHSN administrator is no longer available at your facility, it's nice to be able to transfer that role to another staff person, because we know that it does take a little while to get access into the NHSN system, and there's a specific reporting card that you have to use, and there's sort of, you kind of have to give up almost like your firstborn, but not really, but it's CMS and it's federal website, so there's a little bit of a little more information that you have to give for that. So next slide, Kim. So again, as I mentioned, as the NHSN administrator, you're going to go ahead and you're going to log into NHSN. Essentially, the first screen that pops up, you'll select NHSN reporting. And as the NHSN administrator, you are actually the only person that's going to be able to see on the left-hand side menu. You're going to see this group piece. You're going to click on that group. What's it called? On the menu bar, you're going to click on the group, and it'll say join group. And so what you're going to do is on this screen right here, it'll say actually the memberships that you're the groups that you're actually have conferred rights to. And so what we're looking to see is, if you click on the next slide, Kim, what we're looking to see is that if it shows the group number 83203. And if it doesn't, that's really where we want you to go click join, enter in the group number 83203, and this password. And I will say the password is case sensitive. So if you do anything outside of that, it will say it's not going to accept it. So once you enter in that information, an alert pops up that says, are you sure you want to join? You review that and you say, okay, next slide. And really what this next screen is, I know it's a little hard to see, but essentially what we want you to be able to do, and in the handout that I mentioned in sort of the previous slides that you can click on, essentially what you're looking at is to make sure that your screen, your conferred rights, and your definition of the rights that you've shared with us matches what our screenshots that we have. So essentially, we don't want to see any personal identifiable data from you. We want you to fill out the infection event reporting module and have it mimic what ours is. And then really we're looking sort of at those same infection prevention process and outcome measures. And so those are really the same information. Most of you probably likely have shared with your same NHSN data with your departments of public health. And so you're probably going, well, but if I've shared it with the Department of Public Health, why do I need to share it with you? We cannot see the data that you share with the public health department. And essentially these are unique groups. So while the public health can sort of tell us and guide us with information, they can't share specific data for you because they were only allowed it shared with you. So what we're asking for you to do the same as you would for the state health department. So next slide, please. And then really sort of the final step is kind of as you walk through that and you verify sort of that defined rights page, they'll be at the bottom, you'll kind of scroll down that information. You might have an occasional pop-up that says, are you sure this is the data you want to share? And you say yes. And on the bottom, you just click save. And from that point, it's pretty easy peasy. I've walked through nursing homes on a call and it takes them a matter of minutes. As I mentioned, probably the biggest hiccup is really understanding who your NHSN administrator is, or in the case, I've had some where the NHSN administrator has left, so we've sort of been able to walk through the instructions and the steps on how to do that. But I've included, if any of you want to go in and confer rights, and if you have any trouble with that step, please feel free to reach out to me directly. And that is all I have to share on NHSN.
All right, thank you. So we're at, let's see here, 142. Great, excellent, because, oh my gosh, I am so sorry. Okay, try this again. I got this big old bear in my background. That's his name, Bear. So it's question and answer time. I know we've had a lot of different people putting things into chat. As you can see, if you do have any questions about anything that we have talked about, I mean, outside of our hour that we have together, you have these slides and those are our email addresses. So always, please feel free to reach out to us at any time. And I think Elena put it very well. If I don't know the answer, if Elena don't know the answer, we will find out the answer for you and get back with you. So with that said, I haven't really had a good time to look at in chat. Elena, is there anything new we need to talk about in chat? Opening it up for Q&A.
I think we just got one that we'll be able to address, because I saw, Kim, you had already responded to one. Someone asked about when the Frontline Forces UTI module will be available, and you said in August. So
Yeah,
thank you.
Sure.
And
Yes.
yeah. And if anyone else has any ideas for other topics, I already saw a couple in there, but please feel free to put those in the chat as well. Kim actually will be the person to take that back. So please feel free to put some of those topic ideas in the chat. But then the other question we just got says, an IPCO that I work with recently received an email from Superior Health regarding COVID cases that were reported. Can anyone please speak to this? So Tracy, I'm going to assume, so that's with like maybe there was a COVID outbreak or you had a 3 or 5 COVID cases. Yes. So that is likely our targeted response quality improvement initiative team. So I'm trying to look and see if we have anyone from that team on the call today. Do we have anyone on the call today that's from that team, that 5 cases, that would want to speak to that work a little bit? We can as well, but just in case.
Yep, I'm looking too.
Maybe essentially what they'll do, I'm not hearing anyone speak up from that team. So what they'll do is they are going to kind of help you with some of infection prevention and control. Kim, do you know more details on that?
So the targeted response QII, that QIA, Quality Improvement Advisor, will do a ICAR with you. So they'll go over your infection prevention control program and see if there's any gaps, right, in what you're already doing. And then from there, you'll make a plan with your QIA on something to improve on. You know, something that maybe part of your issue was that it's about hand hygiene, or maybe it's PPE isn't being properly taken on and off, and you need some assistance with developing a plan of action and interventions on improving in that area. And you'll follow with that QIA too on improvement and over, I don't know the time frame, I'm not sure, I'm not on that team, but I know there's a period of time that you work together. It's not, remember, I always have to say, this is not punitive, this is to help This is always to assist. We are not at all, just because we're contracted and work with CMS, we are not CMS. We are here to help you. Hope that helps a bit.
Perfectly put, Kim. Yeah. So you might receive calls from staff members. I think the two main reasons you might receive a call from a staff member right now are both surrounding COVID. One is exactly what you described. You had a small outbreak, you had 5 cases. Sometimes that number changes a little bit with the amount of cases that they would call you for. And then you might get a call from several of the people that you just heard present, Kim, myself, or Jill, about resident booster rates. So those are some of the things that CMS has asked us to help facilities out with. Again, like Kim mentioned, it's not punitive by any means. We reach out to see if there are ways that we can support you. So just keep that in mind if you ever see us, anyone from Superior Health kind of coming across your desk. You can also always reach out to anyone that you are familiar with on this call and ask, hey, what's this for? And we'll gladly let you know. And it is not necessarily related to the conferring of NHSN rights. You can do that though, and it could help out when they're working with you. So I know the team that I mentioned that works with the COVID boosters, giving calls about those, we really try to encourage people to confer rights, because most of the time when we're reaching out about booster rates, it's because we see that little dip that Jill explained where there was just kind of a mistake with reporting. And if we're able to go in and just look at your data, we can say, oh, I see you accidentally hit 32 instead of 62 or something like that. So that's really why we encourage that conferring rights. It really just allows us to help you really quickly pinpoint what's going on and help you see where exactly you can go in and change it. And we can't change anything ourselves. It would just be us being able to let you know where you could go in and change it.
So I had a question, and I actually saw that there were a couple of people that answered this even before I could put the question out. And that was, do any of these frontline forces modules, do they look appealing to any of you, and how would you use them? Like, what would be your situation that you would use them? I believe I had read that they were used for a post-survey plan of correction for a couple of our participants in our audience.
Kim, I can start. We actually, I work with a number of communities, and one community actually utilized the Frontline Forces, the caregiver well-being slides, as a community event. And they actually promoted sort of that self-care, and they kind of had the helps of the event. We kind of walked through the Frontline Forces videos while they're geared toward sort of that nursing staff. It's actually for anyone that can utilize those resources. And so then within their community, they actually post the event with the community. They actually promoted the slides and the sort of those videos within their different organization Facebook pages and their website. So the community was well received from their standpoint.
And there's a couple items chatted into. So Stacy mentions we used, in addition to post-survey POC, for change of condition, hand hygiene, and pressure injury prevention. And then Jamie said, I'm considering using the learning modules for annual and or monthly education. Awesome ideas.
Yeah, those are good ideas. Sometimes I used to work with Relias a lot, but it's, you know, sometimes it's the same thing. So it's always nice to have another, you know, another tool in the shed to pull from, something different, something new, instead of the same thing over and over, yearly after year after year.
Stacy also says, I also used the falls prevention this month after noting falls as a problem on our quality measures report. That's a great idea.
Stacy, did you, after you assigned those modules to the staff, she completed, they completed the modules. Did you see, I mean, I know that's only one intervention, and there's many interventions that go into changing falls. But how is your, was this intervention among any, did that help and improve your fall rate? That typing thing, I think. If you want to, you could just unmute too for a quick blurb.
Everyone's always welcome to unmute. Yeah.
Absolutely.
So Stacy says we've had a reduction in falls, just not sure from which intervention or how long it will last.
I'm sure it's always multiple interventions. It's never usually just one. It's never that simple.
But that's great to see that you had the reduction. That's the goal.
Congratulations. That's a feat.
Yes. And I was just going to mention too, I mean, I think that's really cool that you saw the problem on your quality measures report and you looked for those solutions. And I would just encourage that if others find other issues on your quality measures report and you're looking for some items, if you don't already see them, like we said, we can look to create them. So Stacy, I mean, if you see other things in the future, feel free to reach out. Kim's email address is right there on the screen, or anyone else's that's there, or people that are you're familiar with that lead these calls. Let us know, and we can look into creating something like that. But that's awesome to hear. It's really exciting. Sounds like people are really excited about the UTI modules.
I'll make sure I'll bring that back and say, come on, guys, get it recorded. Yeah, it's coming. Panel, do you have any other questions for our participants today? Oh, Tracy just put in antibiotic stewardship would be a great topic. I have to agree. Yes, it would. There might even be a series on that.
And I'm excited to say that we do have some new Superior Health Connect participants. So you should get welcomed shortly, or you may have already been welcomed.
All right, we got some go-getters out there. Perfect.
Stacy mentions, I like the frontline forces because the staff can do it at work with interruptions rather than attending education outside of work time. Absolutely. I think we're the first to recognize that. We know that you all have distractions, you have things that are coming up. So I know that that team especially works really hard to find, like we said, we want to meet you where you're at. And that's an example of that. We don't want to create things that aren't helpful. So that's really good for us to understand that that frontline forces works for your staff.
Very good to hear. Anything else? Anybody else have any other comments or questions? Did we drop the, Jerry, do we have the survey in chat yet? I haven't looked. I always forget to mention that. And that is just, we're getting up, kind of coming up on the hour. So please, if you would like to, actually, we would love it if you would just fill out these surveys for us. It really helps to understand if we're meeting the needs of our audience. We really appreciate that. And again, if you ever have any questions, there's our emails, you know where to find us. I was going to tell you what next week's event is, and now I can't think of what it is off the top of my head. Elena, can you help me out?
Yes, I think we're going to go in and kind of show you exactly how we have helped other organizations in the past. So showing you, we've told you kind of the different things that we can do, but we'll give an example of how we've assisted a nursing home in our region in improving their COVID booster rate. So we're going to go in depth on that, and maybe it'll help you identify some areas that we could help you with as well.
All right, sounds perfect. So with that, I wish everybody a great day, the rest of your day and afternoon and evening, and we will see you all next week. Thanks again. Bye, everyone.
Thanks, everyone.